everybody, Tim White, clinical specialist here with the Aspen After Surgery Center. We are shooting another 5-day video on a fast track patient of ours, Dawn, who has flown into us 5 days ago here on Monday. Today is Friday. We're going to report your experience of how much progress you've made so far just within the 5 days. Even though you're not done, you still have another 30 days of doing more stuff and getting more improvement at home. Overall, how'd you do?
I mean, it's been miraculous. Exceeded my expectations. I feel I still am in a little disbelief at how good the result is. Honestly, it's been amazing.
Yes. In full clarity, Dawn is our star student. We have a realistic expectation of patients achieving 50 to 80% measurable objective improvement within the 5-day fast track. Dawn has exceeded that, being, 95, 100% plus, meaning softness, position, shape, discomfort. So let's just give a brief history. So Dawn's original surgery was when?
It was in, I believe,
year?
3.
03,
yes.
So Dawn's original first surgery, basically your breast augmentation, was in 2003, and then progressively over time you had noticed that the breast implants had started to harden. And we haven't really identified a true trigger, but we do know that Dawn had a not worked up, undiagnosed potential thyroid issue that's continuing to be medically worked up that we think may have been the trigger for why this happened. The other thing is you had a massive amount of dental work done, and dental procedures, like any surgery in the body, release bacteria, and that could be the trigger. So we're not telling everybody don't go to the dentist because of this. But just note that if you go to the dentist, talk to them about getting antibiotics like you had a heart surgery or a hip replacement. And tell the doctor you want the same protocol to prevent the possibility, okay? So please, everybody, I'm not going to get 1,000 comments from, dentists telling me, how dare you? No, it's true. This is within the scientific body of evidence. So then you had a revision. You had a revision in 2018?
No, in 2012.
2012, you had a second surgery to the breast, which is a revision surgery to surgically correct your capsules. And then progressively since 2012 again, 6 years later, you started noticing that this happening again. But this is where you started the whole kind of, I'm getting my workup, we're looking into my thyroid, we're seeing what's actually going on, that's being medically managed, and you may have had some more dental work as well, right? So we don't have kind of the smoking gun with Dawn, but we have a lot of usual suspects of what we're seeing here. Nonetheless, Dawn reached out to us, and she's out of town. She said, hey, I want to do the fast track. So Dawn flew in. We did the treatment on it, and her treatment is actually for both breasts, right? So today, 5 days later after starting the treatment, we reevaluated based on softness, our objective measure, as well as Dawn's report. You said your left breast got how much softer, 0 to 100?
I said 80% on the left, 90% on the right.
Right.
Yeah.
Now you guys will see in the picture, Dawn did have the classic obliquity, meaning one breast was higher than the other. Take a look at the before photo and then the after photo. You'll see how much she's transitioned. Huge drop, even in just that little bit of time. You're basically 100% dropped, and symmetry is better at this point. And Dawn's not done. She still has another 30-day home program, so she's going to continue to soften. Shape and symmetry will round out a little bit better, and she'll continue. We're going to do a Zoom call with her in 30 days from today to see what your final is and how great you did. Which anybody out there watching, remember, I don't care where in the world you are, we can do virtual evaluations with you in the privacy of your own home, in which we can evaluate you, look at you, have you test the firmness, shape, and we can give you a very good objective measure, because that's what we did with you.
Exactly.
Right? We did a virtual, and we were able to give you information that maybe even other people didn't give you. I can tell you that typically in the surgical community, this is kind of a passive sort of, well, you got a capsule and we'll just do a surgery. It's not really grade, stage, how high you are, measure you, look into triggers. Why did this happen to you? Because the surgical community, and in their defense, doctors are busy, and it's just I only have one solution. Doctors can only give you one solution. It's either surgery, which on your first surgery you have a 70% rate of re-encapsulation. If you had a second surgery, which we were trying to avoid, and I think we did.
Yes, we did.
90% rate of reoccurrence, and all the other stuff that they recommend. They recommend asthma medications, Accolade, Singulair. Those are not FDA-approved medications for the indication of capsular contracture. Your doctor may say, well, I'm going to do a surgery with a mesh or an ADM, or I put this little skin strip in there. None of those things are FDA-approved for them. And in our 8,100 plus patients that we've treated to date, I see lots of patients on Accolade, on Singulair, doing massage, having the skin strip put in, thinking it's the miracle, being told that the type of implant matters. They encapsulate anyway. Remember, encapsulation is our body's autoimmune system. It is not how good your surgeon is. It is not the type of implant. It's Dawn.
My body.
You're the problem.
I know.
Dawn.
It's
How
my
dare
body.
You screw up your how dare you screw up your surgeon's
I know.
procedure like this? Because here's the reality. This is the breast implant. The breast implant goes in, and then it creates this shell. And this shell is the root of all that is evil. That shell forms around the capsule, and it's the tightening of that shell that causes the implants to ride up high, become high, tight, firm, painful, and all the other symptoms that are associated. So the difference between the Aspen treatment protocol is that we're not removing the capsule, because that's what doctors do. They either slice this and loosen it, or they take it out completely, and then what happens? The body naturally makes a new shell 100% of the time. 70% of the time, it retightens and you're right back to where you started. So the goal is to not have surgery, which is our technique leaves the capsule in place and it stretches it out, it loosens it, and it causes the implant to drop so that the shape and the position and the symmetry and the pain go away. By the way, this is not cockamamie techniques here. These are proven evidence-based therapeutic protocols that we tweaked the technology and protocol for, that we've been doing for over 40 years in physical rehabilitation. This same exact thing happens in shoulder. So anybody watching, you've heard us in our other videos. If you have breast implant capsular contracture, you have either had frozen shoulder before, or you're very prone to it because it's the closest medical cousin to this. Because frozen shoulder is the same thing as frozen boob.
Yeah. Mm-hmm. Yeah.
Okay, we've got a new word for it. It's
I think
ours.
so.
Anybody with frozen boob, okay, it's the same thing. The ball and socket capsule squeezes down, and that's why women can't brush their hair and they can't put their bra on, because that capsule tightens on the shoulder just like the capsule tightens on the breast implant. So you did awesome.
Yay.
Yay, good for you. So Dawn has a home program. We've already shown her what to do. She's going to keep doing that. We'll meet her by a Zoom call. Was it worth getting on a plane and flying here to us?
Absolutely. I mean, the difficulty of surgery is so great. The recovery of that is so hard, and the pain, and you still could end up right back where you were. To come down here was, I mean, the people here are so nice. I had a wonderful week of just being here and being taken care of, and they put me at ease, and it was 100% worth it to travel.
I mean, it is Florida.
Yes, it's very lovely.
The weather has been great.
Yes.
You get to go to the beach,
Yes.
do some fun stuff while you're here,
Yeah.
and knock out your implant contracture.
Yeah.
I mean,
It's a win-win.
Sign me up.
Yes,
I'm
definitely.
ready for it, and I live here. So, yeah, that being said, if you really quantify this, if you imagine if you had surgery, you would have had weeks of recovery, downtime, out of work, lost wages, pain, discomfort, risk for another capsule, and then infection, hematoma, seroma, and all the other stuff that goes with it, versus, pull the trigger.
Yeah.
Just do it. Get on a plane, get here, 5 days. Even though your results are atypical in full clarity, most of our patients with the fast track are about 50 to 80% better. They're not almost completely done like you are, but that is the majority. That is not the atypical. And our research has proven this year after year after year. We've been doing this a long time. This is not new. This is new to some of you because you just first found us today.
Yeah. Mm-hmm.
You had to find us, didn't you?
I did.
You did. And that is the issue that we're broadcasting through our YouTube, through our social media. Everybody out there, go on Real Self, look at the reviews, write a review, because here's the reality. The problem is the surgical community is a cash-based business, and your issue is a moneymaker. Surgeons make money to do revisions, capsular revisions, and at no discretion of any fault finding with the surgical community. The reality is there are options. There are 10 plus years of research, evidence-based medicine. Surgeons know us internationally from around the world, but are you going to hear about us from them? Probably not, because we're not seen as colleagues, unfortunately. Everybody here has a medical license. We're all medical professionals. We are not a med-spa. We are a licensed rehabilitation practice. And to be seen as a colleague, unfortunately, has been the toughest part in all this. We're seen as competitors because we're fighting for the business of helping patients. So, and that's really frustrating. So the best thing you guys can do is, first of all, subscribe to our channel, please. Hit the notification bell. Please like us. Comments totally welcome, good, bad, or other. Let your friends know. Go on our social media. Our Instagram page is Aspen After Surgery. Same for our Facebook page. Share it. Let people know. Bring this to your surgeon's attention. Everybody out there, in the instance that Dawn couldn't get here to us, you can let your surgeon know that you want the Aspen treatment. If you weren't able to get here, we could have potentially put this treatment in your surgeon's office, and you could have done the treatment there. So if you are not able to get to us, bring this treatment to your surgeon's attention. We can get them the system. You can do the treatment in your surgeon's office. And instead of paying us, you can pay your surgeon. I mean, it's win-win-win.
Yeah.
So, lots of options. But, big deal is we're asking everybody to share this. So, try and get the word out. Let other patients know. So you don't have to work hard like you and lots of my patients do, which is hard, high, capsular contracture, and then, you find us, which is frustrating, right? Because you went to your surgeon, you've dealt with this twice, you had to find us on your own, you are the victim of success, and that's frustrating because now you say, well, why didn't my surgeon tell me about this? Well, we already talked about that, okay? We work with every major plastic surgeon around the U.S. and internationally. We respect all the surgeons and their position, and it is a tough position. In all truth, I would never want to be a plastic surgeon, because imagine being in a position where they do a surgery on you and they know you're going to encapsulate. That's pretty tough, but they have no solution. When your only tool is a scalpel, everything looks like a cut. Right? Remember the saying, when your only tool is a hammer, everything looks like a nail. It's the same thing. So, we're just glad that we're able to help you. If anybody wants to email you or reach out to you, can we share maybe your email or contact information to make sure that you are a real human being?
Yes, I would love to, because I think it's important. And I am shy. I'm a little shy of like all the, social media, putting myself out there, but I am doing this because I really do think it's going to really help people. And so I will totally make myself available.
Is this your honest review?
Yes, this is my honest review.
I'm legally obligated to ask you, did I pay you or give you any incentive to do this video?
No. Not...
All our testimonials are real people, real patients, talking about their experience. We are sitting in one of our rooms right now with a ring light and an iPhone, I think that's the 12, is that? An iPhone 12, shooting a video. We are all clinicians, real people. This is not produced, this is not staged. And for one goal, to help patients like Dawn get better. And now she's going to leave us and get on a plane and go home. And
very happily.
But
awesome. If you are wondering if it's real, it really is. And it's extremely professionally done. And you need to look into it. You really do. And I'm happy to talk to you.
Awesome. Dawn, thank you so much. Hey, everybody, again, click that subscribe below. Any questions, call us on the 877 number on the banner below. Email us, message us, whatever you want to do. Don't forget, virtual evaluation, super important. Hit us up with a virtual evaluation. We can tell you something that maybe your surgeon didn't tell you, or offer you a solution, even if it's not us. A rare group of patients cannot get the Aspen treatment for certain reasons. We can tell you what that is, but we can tell you what your options are. So Dawn, thanks again.
Thank you.
All right.
Very much.
Everybody, take care.
Thank you.